Now my mother, and we're filming here at our Carlsbad studio in San Diego, she lives in Pahrump, and she says, Randy, and she's 73, she says, Randy, I don't care what you say. She doesn't believe me, because I was telling her what you said. And she's 73, been in dentures since she was 28, and she said that she was told by her medical doctor, and I've told you this, that she's not a candidate, that she cannot get, does not have enough bone for dental implants.
You know, you should bring her to my office.
Well, she doesn't believe it. She goes, well, why would he tell me that? You think that even with medical doctors, because they will watch this show, that they may think that it's not possible to get?
Yeah, there's still, you know, there's still dentists out there, or periodontists, you know, like your friend, that doesn't believe that it's going to work, but it does work.
Are you surprised, by the way, sometimes with the outcomes? I mean, when you first started doing this?
I am just excited about what I can do for a patient and how much it can change their lives, how much they can, you know, increase their self-esteem, you know, because these are the patients that have been wearing denture for such a long time. Now they can feel the roof of their mouth, they can taste better, they taste the food better, they can chew better, and it's just changing their whole entire life.
So you really think that, I mean, you're changing people's lives?
Oh yeah, definitely. I mean, look at this patient. This is a patient came to my office, and he wanted to get all his teeth fixed. He wanted.
I mean, this cannot be common.
Oh my God, there's so many people that are walking around like this, but they're just not smiling, you know?
What was his options? This is a guy, is that right?
Yes, this was a guy that, you know, wanted to have fixed teeth. He didn't want to have dentures. And there's a lot of patients like that out there, and they're holding on to their teeth because the fact of having something removable in their mouth, you know, taking it in and out, it's just embarrassing to them. So, you know, there is periodontal disease, there is bad breath, and these are the people who have wives. They don't want to kiss their wives because of their bad breath.
Now, how does this even happen? I mean, I guess that's a big question, but how does that clear up, I guess, is my question.
Basically, by extracting the teeth, the periodontal disease will go away, and we will place implants. Now, on this patient, we went ahead and placed like 8 implants on tops and extracted the one that needs to be extracted.
Huge difference, by the way.
Yeah, and we did the same thing on the bottom. He got like 8 implants on the bottoms, and we restore all the bottom teeth.
What does a guy like that say to you? I mean, when it's all done?
Oh my God, he wish he would have done it a long time ago. He wish he would have done it like 5-6 years ago, because he's been walking around with pain and agony. He would rather take the pain and not having a denture.
But why does a person like that wait so long to do something about it?
Well, people are afraid of pain, you know. They don't want to go to the dentist. They don't like to go to the dentist. And
did he say it was painful?
No, because first of all, he was all, you know, sedated.
Okay.
So we make sure the patient is always comfortable, and we extracted the teeth, placed the implant. Implant does not create any pain, because in bone there is no nerve. On the upper jaw there is no nerve. So when the implant goes in, there is hardly any pain. Patient, especially this patient, have not taken any pain medication after I placed the implants.
Okay, now the only thing I don't believe, by the way, that you've said so far, or not even today, but when I met you, was that after placing implants and giving them the crown, that they could bite an apple after the procedure.
After the procedure.
You're going to have to get that on film and send that to us, because that is hard to believe.
We're actually going to have one surgery that's going to be filmed pretty soon.
And they bite an apple.
We're going to have the patient to bite on an apple right after the surgery.
Okay, so you put it in the bone, and it becomes the bone, but doesn't the bone have to heal around it? I mean, doesn't it have to grab onto it?
We place the implant in the bone, and it's got enough anchorage. There's enough anchorage on the implant that can hold up to the bridge, and the patient can chew the same day.
The patient must also feel worried about biting into an apple.
Right. They're all concerned because they didn't. Yeah, because they had either dentures all their lives, or most of their lives, or they had teeth that were so loose and, you know, decayed or broken down that they didn't want to chew anything hard. So it's changing lives, especially this whole procedure.
So the denture wear benefits the most.
The denture wear and the patients who, you know, are perhaps teeth have been compromised so bad that they have to be extracted.
What about somebody that says, and I know somebody like this, that they say, well, I have bad gums. I can't get dental implants because my gums are no good.
That's not true. One thing is bad gums comes from periodontal disease. Periodontal disease comes from the existing teeth that are in, you know, in their mouth, and due to the lack of oral hygiene, they have gum disease.
And it goes away.
And by extracting the teeth, making sure that there's no more plaque and there's no more plaque there when the teeth are gone, so the periodontal disease will go away.
What about your training? I mean, what kind of formal training have you had when it comes to dental implants?
Oh gosh, there's courses after courses. It's a learning curve. I started this 10 years ago, and I'm so much better now than when I was 10 years ago, as far as dental implants and this new system that's out there.
You call it a system. When you're talking about system, you're talking about this all-on-4.
Yeah.
That's okay. 4 implants to secure a lower denture.
4 implants to secure the lower denture or the upper denture.
Okay, we're going to take a quick break. When we come back, more about what what you could do for the single tooth and people that are just missing 3 or 4 teeth and why they should do something about it. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're here with Dr. Golpa, and we're discussing what you need to know about dental implants. We'll be right back.
Designs for Health is the nutritional supplement brand of choice, exclusively recommended by healthcare professionals.
As a physician, I insist on the science-first approach of Designs for Health. They have synergistic formulations with optimum quantities of therapeutic nutrients.
Designs for Health, the leader in professional brand nutritional supplements.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light super activates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. Okay, we've talked a lot about the denture wear. I mean, if somebody's just missing 1 tooth, why is that important that they get a dental implant over traditional dentistry?
Well, dental implant, you will preserve the bone. So, if a patient is missing a single tooth,
okay,
it's better off to place an implant and preserve the bone rather than the old traditional way was to carve down the adjacent tooth and putting a bridge over that. There was, it was a snowball effect.
They carve them down.
They would carve them down. There's chances of, those teeth could become prone to decay because the margins of the crowns, and also you will be losing bone where you're missing the tooth.
You say the mouth begins to collapse. Is that a fair statement?
Yeah. Yeah.
So you miss 1 tooth.
You miss 1 tooth. What happens is the teeth start shifting. If you're if you don't replace it, the teeth start shifting. Your whole bite will change. So when the bite changes, then there's going to be probably clenching or grinding of the remaining teeth. So the whole thing over years it's going to become a mess.
Okay. People that are missing 4 or 5 teeth in their mouth. What about them?
Well, the option they got is to place like two implants and to put a bridge over those implants, or to just place single implants and to replace every single missing tooth, which that would be my ideal option.
What about people missing 4 or 5 teeth on the side?
These are the patients that we really need to see, because these people are headed for a big problem down the road, as far as if they don't replace the missing quadrant or missing teeth, what's going to happen is the upper teeth is going to start erupting downwards, and there's going to
because of the bone, goes away.
Bone's going to go away, and also the opposing teeth is going to start erupting downwards.
At the break, you said these are the people that need to do something right away.
They need to do something right away because the whole bite is going to change, and it's going to be a mess.
What about expense, though? I mean, obviously people are going with these other options because it's less expensive.
Right. I mean, with all these expenses that patients, spend all the money on the root canals, saving a tooth, placing a post, build up, put a crown on the tooth, they could have had an implant right from the